My name is Maryanne Roberts. I'd just like to say Nullingar, Jingiwalla. That means our country, and welcome from all the past, present and the future custodians of our country. So,
Thank you so much, Maryanne.
I'm 61,
Okay.
nearly 62.
I understand you did have a heart attack. When did that happen?
Back in 2003,
Yeah.
I was messing around. At the time I was having a cigarette, and I used to smoke like full on.
Yeah.
At that time, I was smoking 3 at a time. 3.
How do you do that? Do you
Just
light 3
light
up?
one
at
up,
once?
put it out. When it's finished, light one straight away.
Yeah. Yeah.
And I used to do 3 at a time, just to get the quench of the craving for a cigarette, and that was just being stupid, I'd say. I used to smoke half a packet a week. I was at the back having a cigarette, and I said to my son-in-law and my daughter, I said, "Oh, when I finish this cigarette," I said, "bring the ambulance." And they said, "What for?" I said, "Oh, I'm not feeling good." I said, "There's a bit of just a tingle in my arm." I said, "It's nothing really." I said, "Oh, but I've never had this before, so I'd like to get it checked, you know." And he said, "Well, what are you doing at this having a cigarette for?" And I just laughed at him. So they rang the ambulance after I finished. The ambulance came, I walked out, got in the ambulance, joking about everything, all the way from Evans Head to Ballina. Got to Ballina, got up on went into emergency. He laid me down on the table and he said, "I'll put an ECG on you." I said, "Okay." I was laying there, just still joking around. Anyways, he said, "There's nothing wrong with this, nothing come up." He said, "You can go home." So I stood up, and when I stood up, just dropped dead, without any signs whatsoever. Then they brought me around, and when they brought me around, I was trying to fight them off because I didn't know what was happening to me. And trying to fight them off, I couldn't see them, and then I dropped dead again, just dropped. And from that second one, I didn't come around. They then brought me from Ballina to Lismore, and I spent a week here, I think, week or 2 weeks. And then from here, I was still in a coma. They took me by chopper to Princess Alexandria in Brisbane.
Yeah.
And I was on a life support machine for, I think, 2 weeks in Brisbane. And then I eventually come out of it. And at first I didn't remember, I didn't know my family. I didn't know who they were. And they started to, just about, 20 minutes later I started knowing them.
Coming to
it, yeah. And then I had to learn to walk again. That took forever.
Yeah.
So after I'd done all that, the day I left the hospital, after I come out of all that, I never touched a cigarette since.
Wow.
I never, couldn't do it. Didn't want to.
Yeah.
And I try and tell my families, my people about cigarettes, to give it up. It's not going to do you any good, The thing that came to me was either have a cigarette, take that, or your life. What would you choose? You choose your life. So straight away, I just, when people tell me that it's hard to give up and they need patches and everything, it's mind over matter. If you know that you can do it, you'll do it.
Yeah.
For the reason to live.
Absolutely.
Yeah.
So how old were you when this all happened?
40s.
Yeah. So quite young.
Mm.
And there was no signs.
No
this was
signs
going to
whatsoever.
happen.
When you go through something like that, and to live this long afterwards, and they tell me not too many people last this long, like 16 years later, or whatever it was. I think it pays to not smoke, to eat the right meals, drink plenty of water, have your regular checkups with the doctor. You know, all these things. There's just the littlest signs of pains in the arm or tingles in your fingers and in your arms. It pays just to ring up to the AMS or someone, you know, and say, you know,
something's
I need to have a checkup. Like, I go and have a checkup, and I'll say to them, can you give me a referral to Dr. Blank to my heart specialist? And I'd like to know, like, if I didn't go in the last 4 weeks ago, I got another stent put in, and this is my 3rd time. If I didn't go down 4 weeks ago and ask them to give me a referral, just to have that check, because I was feeling tightness in the chest, really, really tight. And I was getting, at night I'd lay down and I was getting a lot of palpitations. With having that, I was worried.
So you knew what to look out for?
I knew what to look out for, because I didn't have these feelings before, you know, and lucky I did, because I had another blockage. It was the old stent that was blocked.
Right.
And that forced the new stent through it and then expanded.
Yep. So lucky that you...
Oh, lucky I did.
...did know those symptoms.
Yeah. At the same time, my sister, my younger sister, she, the Tuesday, she had a heart attack and didn't even know. And then the Friday comes, she went down to the emergency in Lismore base. They put her straight in because they told her she had a heart attack. And they need to admit her. So they admitted her, and then the doctor, my heart specialist, booked me in to have the stents done. They had to keep me in for a week, so my sister and myself were in together.
In the same room?
In this next room to room, next to each other.
With similar kind of
She had the heart attack. She's so lucky that she went in, because if she would have had an heart attack, they said she'd had a massive heart attack, because she had 3 stents put in. She had 3 blockages. And she didn't even know she had a heart attack. So it just pays to go and have that checkup all the time, you know, with the doctors.
Yeah. Was she a bit more aware of her heart because of you?
She didn't know.
She didn't know.
She didn't know.
So she wasn't getting it checked.
Well, they want all my family to come in and have a checkup. So I've spoken to every one of them. They're going to have the checkup done. All I say is... listen, just go and have your checkups regularly, because you don't know if you're going to have a heart attack. I didn't know. And I just, like I said, I just dropped not knowing anything. So it pays to have your regular checkups all the time. Even when you feel the littlest, strangest feelings that you never felt before, you know, they're symptoms of a heart attack, and you don't even know it.
So how can we get this message out to your community, everyone in this region, you know?
I think all these health workers, they need to, and I said that they need to get out and go amongst the people, because the people won't come in. You know, my people. They won't come in. A lot of them, they're scared of doctors. They're scared to go and have a checkup. They're scared to know if there's anything wrong. They don't want to go through that. But it's best if the health department, I said they should get out there more into the community and go and speak to the people, you know. All I see is like pamphlets. There's a lot of pamphlets in the surgeries, a lot of pamphlets in the health departments, but nobody gets out there in amongst the community. Nobody. And I know, because I go around myself and talk to some of my family.
Is there anything you would do differently?
Like the things that I know now, I wish I knew before I had the heart attack. But the things I do differently now is just focus on, like you said, getting the message out there. focus on my families, focus on my people, and keep on talking to them. You know, I try and encourage them every time I'm sitting with someone. Just a little yarn. If they come up with something like about cigarettes or something, or I see them smoking too many cigarettes, I'll try and stop them. I don't have too many takeaways. I don't have takeaways at all. My husband cooks. We normally eat at home, and I drink plenty of water. All throughout the house, wherever I sit, in the lounge, I've got a bottle of water there. Next to the bed, I've got a bottle of water there. So everywhere in the house I go, you know, I've got plenty of water. And he cooks good, healthy meals. I try and look after myself.
Yeah. Are you part of any exercise programs? Or?
No, I'm not.
Yeah.
I do what I do at home.
And that's keeping you pretty fit.
Yeah.
Yeah.
So I do. I'm pretty active at home.
And you
I'm
probably
pretty
have
active
a lot
with
of
my
family?
grandchildren.
Yeah,
my
family?
friends, yeah.
How many grandkids have you got?
I've got 5 grandchildren, 3 great-grandchildren.
Yeah. And I guess you really want them to get these messages about looking
I
after yourself.
I teach my family every day.
Yeah.
I teach my family.
Yeah. As they grow up, those messages will keep coming back to them.
It will.
Yeah. You're planting that seed, and that seed will grow. Yeah.
I'm proud of my girls, and you know, my grandchildren, because a lot of times I see them. They'll do, you know, that they're listening to me. I know they're listening, so that makes me happy because I know that they're listening and they're looking after my great-grandchildren, my granddaughters, and my grandchildren, the other 2 girls and my young grandson. They're pretty healthy. They're into a lot of sports, you know, and they're good. Yeah.
Fantastic. That's good. Well, it's been a really amazing experience chatting to you, Maryanne, and your story is inspirational. And I think women out there can take a lot from it, and just getting that out really widely about it's a silent killer. We often don't know that it's happening to us until sometimes it's too late. So thank you so much for coming in today.
Thank you.
We really appreciate it. Thank you.
Thank you.